Hey guys, it is Coronavirus day 416, and stay at home to day 24. Yeah. Yeah, just wondering if you were wondering what the SAH meant was. It was stay. It's a short form for stay at home. Yeah. No, you know. It's Interstate 25, so we're almost over. So, however, unfortunately, coronavirus cases have gone back up of the roof. And with 3,723 cases, I know it seemed like it was decreasing and then suddenly it went up again. So, anyways, Toronto is in drastic, in the troubling 1,198 cases. 797 high cases is from Peel Region, 306 is from York Region, 237 is from Hamilton, and 232 is from Durham Region. 23 deaths have been reported. And of course, they're just, I don't know why this is decided to show the variant cases, but of course, let's start off with variants. So, the UK variant, unfortunately, is at 72,313, which still makes it even worse, which is an increase of 2,817. 291 South African variants, which is plus 10, and 875 Brazilian variants, which is a plus 103. So yeah. You probably noticed now why I didn't mention the India double-mutant variants, because apparently they're not. And the Canadian Health Canada didn't. Did the absolute lousy job by not actually clarifying the India double-mutant variants as a potential threat, like a variant threat, like they did for the UK variant, South African variant, and Brazilian variants. And they obviously they forgot 300,000 lives are die every day in India, and cremations and body burnings that have been involved, and it's just hearing about this, it's just, oh my god. And so this is why, and of course there's the flight cancellation thing that's still going on. This is why Ontario Premier Doug Ford and Brampton Mayor Patrick Brown have requested for more strength their flight ban, flight rule changes, because also they might have banned direct flights from India and Pakistan, but they have not banned connecting flights from. Of course, they can't really do that because my guess is my assumption is I actually looked at this, and and people from India and Pakistan could easily just go through in the airports in Incheon Airport in South Korea, Beijing Airport in China, or the Tokyo Airport in Japan, or maybe other airports in other cities in other countries in Asia, and can connect to Canada uh, through Vancouver, Calgary, Toronto, and Montreal that way. But of course, travel is supposed to be essential right now. But the problem is that the India variant, double mutant variant, yeah, it affected Brampton quite a lot actually in Ontario. So this is why Mayor Patrick Brown he is also requested for vaccinations of essential workers ASAP, and of course Doug Ford he sent some ventilators over to India. Yeah, but also received backlash because why aren't you like taking care of of matters in Ontario first? And of course, that has been proved that federal and provincial governments didn't really pay attention to what the scientists, doctors, and nurse and healthcare professionals have said. So yeah, there's that. And of course, why Toronto the cases might be so high right now. It might be because of this. So Toronto Public Health Unit, they did an investigation. They're investigating coronavirus cases outbreak linked to a quarantine hotel near the airport, and this is at the Crown Plaza Toronto Airport, which is in the Etobicoke and near the near Highway 27 and Dixon Road. So this is close to the Toronto Congress Center. Like I've been to the Toronto Congress Center before. Yep. So staff are like according to Dr. Davina Duvey. So staff are like currently investigating to work with the facility to identify all cases and review and advise on all appropriate public health measures, infection prevention, and control measures. So it was not revealed how many cases are from the Crown Plaza Toronto Airport Hospital. The hotel, but they have never really said. So anyone who's staying at that hotel for quarantine, yeah, they might be affected right now. So the Crown Plaza Toronto Airport Hotel is one of the 20 government-approved quarantine hotels in cities. So though travelers entering Canada from abroad must stay at one of the 20 hotels in Toronto, arriving at Pearson Airport for 3 nights while they await for the result of the coronavirus test result they had to take at the airport. And apparently it was originally it was expensive, like $1,000 per night or something, but now it's sort of, I think it's free, I believe. And of course, those with negative test results can continue their 14-day, so like 2 weeks quarantining at home for 2 weeks. And the other reason why Toronto might have a long-term care home that increases because of a long-term care home that increase capacity and yeah. And the people who work at these places are like they're stressed. They're going through the same stress and freak out and that's that ICU nurses at hospitals are going through. So anyways, if you're like no, that's it. So if you want to get vaccinated, you have 3 options. You could go you can book a vaccine this way. You can book a vaccine online through the COVID-19 .ontario.ca/book vaccine. By phone by 1-888-999-6488, and this will be the but if you wait long enough, instead of you getting vaccinated by the AstraZeneca vaccine, you'll get the much more effective Pfizer BioNTech vaccine or the Moderna vaccine. And it depends when the Johnson & Johnson single shot vaccine arrives. But of course, if you don't meet the requirements, yet your doctor or healthcare professional recommended that you get vaccinated. So your other choice is your third option is at your nearest pharmacy. Of course, they're going to vaccinate you with the AstraZeneca vaccine, so there's that. So there's that. So stay-at-home rules are until like this coming Wednesday is the last day. After starting Thursday, we're free. And we're back to color zones, I assume. I got the rules down below. And there's, of course, there's a checkpoint, specific checkpoint rules. If you were going into Quebec for crossing the provincial border into Quebec for any specific reason. So please follow both Ontario and Quebec border rules. Of course, coronavirus cases. Let's look at that. Hospitalizations. So hospitalizations are sort of decreased to 1,961, which is at minus 191 compared to the other yesterday. Okay, so 895 ICU patients. This is the official new second highest patient numbers, and 615 of the ICU patient using a ventilator, so that's a minus 22. So the sort of easing out for the nurse ICU nurses, but still, serious. And of course, the government being shady again, and there are absolutely no reports for on the long-term care home deaths or outbreaks, because since the transferring of ICU patients to the long-term care homes, and of course the government's acting shady. Screw them. So just note, enforcement officers have the authority to break up any gatherings, and fines will be given out at $750 plus $130 surcharge, and organizers will be charged without $10,000. Please follow coronavirus safety regulations. Stay-at-home rules. Don't have any gatherings. Please follow Ontario and Quebec border rules if crossing for essential reasons. Remember, to those people who are trying to break the rules, your rights aren't more to be you anti-lockdown and anti-stay-at-home people. Your rights aren't more important than the rest of us trying to lower coronavirus cases and ICU patient numbers, because the lower we go, the better it is for the rest of us. So let's hope cases go down, hospitalizations go down even more, and ICU also goes down. Stay safe.